Hello, my name's Andrea Lewis and I'm the Chief Nurse here at Ashford and St Peter's Hospitals, and I'm speaking to you today to give you an update around our visiting guidelines in light of the COVID situation. Now, I did speak to you quite a few weeks ago to outline what our visiting restrictions were in light of the COVID situation, and those particular restrictions were, just to remind you of those, was that only one parent is permitted to be with their child whilst in hospital, one birthing partner being able to be with their partner during labour in the maternity unit, and also one mother being able to visit their baby whilst in the neonatal intensive care unit. And we did say that no children were allowed to visit the hospital during this time. So we have now reviewed that guidance, and I did promise you if there was a review that I would update you, and I can now tell you that following that review we are permitting visits to patients who are sadly at their end of life. And in order to be able to facilitate this change, we do need to do it in quite a controlled way because we are still within a lockdown. So the process that I'm going to outline is what we are going to do if you do want to come and visit your loved one. The first step will be that a member of the ward team will be the one that will deem it, if it's appropriate, if your loved one's at end of life, to whether or not that visit should be permitted, and they will then get in touch with our palliative care team here at the Trust, and a member of that palliative care team will then get in touch with yourselves to organise a date and a time for you to visit the Trust, but also to go through the risks that are associated with coming in to visit. And they will do some sort of risk assessment with you as well, just to make sure that you're not going to put yourself at any undue risk actually through the social distancing that we're doing and the social isolation that we're doing as well. And if it is deemed okay that you're all right to come and visit, then as I said, a time will be set, and you will come to meet one of those members of the team, of the palliative care team, to then get put into the personal protective equipment. And once that's happened, you will then be escorted to the ward to visit your loved one. I have to say though that there are clear risks associated with this, and it is because we are still in a lockdown, and the risks that I want to highlight is that we do want to really minimise the spread of this virus and want to keep people safe, because we do want to save lives. And it is about why we did restrict this visiting is about reducing that footfall within the hospital, and it's about not just protecting our staff who need to go on and do the job they need to do, but it's about protecting our patients as well, and obviously yourselves. So hence why we've done this we're proposing to do this in quite a controlled way. But I do absolutely appreciate it is about getting that balance of you having the opportunity, if you want to say goodbye to a loved one. I do want to stress as well though that I don't want to put any pressure on anybody who doesn't want to come into the hospital, because obviously they want to adhere to the principles regarding the lockdown and trying to minimise that social distancing and also the footfall within this hospital. We are absolutely giving your loved ones the best care possible, and we do have other means of you being able to communicate to them, and that's via the iPads that we do have on the wards, and I did mention this in my last message. And also, obviously, the patients themselves and their own phones of being able to communicate to you. So there still is that line of being able to communicate to your loved ones also. All I would really say is that the safety of everybody is absolutely paramount, but it is about getting that balance of having the opportunity to say goodbye. And so I think it is absolutely appropriate that we have revised and reviewed our visiting guidance as a consequence. In the meantime though, if you do have any questions around this or any queries, then please do get in touch with our PALS team, who will be very happy to answer those for you. And their number is on our website, so please do look at that if you do want to get in contact. But in the meantime, I thank you again for your cooperation during this time. That has been very much appreciated, and if there are any further updates with regard to our visiting, then I will absolutely update you accordingly. Many thanks.